Thank you for staying with us on Daybreak. As I mentioned at the start, we're discussing the plight of medical interns. And with me in studio, I have Dr. Abdiado, intern, Bagathi Level 5, Nyakio Mburu, who is the Secretary General, Medical Students Association, as well as Dr. Angela Nambiro, who is a medical officer intern. Good to have the three of you. We expect Dr. Issues on the table are, salary arrears. And then fees for registrars since 2019, medical cover as per SRC guidelines, promotions, and postgraduate students, KNH, MTRH, have not been paid as agreed overtime, as I understand it. Perhaps in the last few months have seen, have sort of brought to the fore the plight of medical interns, the working conditions. There's a story, I believe, which was on Monday that was carried by the Daily Nation, a doctor at KNH who had worked for very many hours, that he was unable to monitor, I suppose, his glucose levels, and he was hypoglycemic, and he died in his house. We've seen stories of medical interns taking their lives. Just perhaps you can tell me whether you support the strike action. I'll start with you, Dr. Ado.
Okay, good morning. As for me, I really support this strike simply because behind closed doors there are negotiations going on, but these negotiations, it seems they are reaching a dead end simply because for a whole year nothing has moved from wherever we were. So the only way, and remember also, a strike is a way of negotiation also. So I really support this because we doctors are really suffering, and we are going to explain further how we are really suffering. But for me, I do support the strike. Yes.
Dr. Nambiro, when I was growing up, studying to become a doctor was a very big deal. But of late, the stories we read about 4,000, I believe it was last year sometime, there's a headline about 4,000 doctors being unemployed. You read the stories about your working conditions. Perhaps you can tell us a little bit about your experience, because you are a medical intern. When were you placed?
We started working on August 1st, 2024. So maybe I can take you through a typical day of an intern, as I've gone through my surgical and internal medicine rotation. We start our ward round as early as 7 a.m. because you have to do a pre-round. If you're doing your night call in the previous night, you have to stay until after the ward round. So let me start my day at 6 p.m. the previous day. I do my night call, handle all the emergencies. Chances I'll only sleep for like 2 hours or 1 hour, depending on how busy my night is. And then in the morning, I do my pre-round, wait for the senior consultant to come in. I haven't slept, I haven't had breakfast yet. We do our ward round for almost 3 hours for me to update the patients I've admitted at night, for me to update the consultant on the medications we've given the patient during the emergency situation for the patient to be stable, and present the history and physical exam. History is looking at the patient in a wholesome context. They are presenting symptoms, their family social history, their past medical history. It's I, the intern, who will know if this patient will afford metformin or insulin. It's I who know their background to know why did they come with this disease at this particular time. My senior consultant will just give an additional view based on their experience. It will reach at around 12 or 1 p.m., depending on your center as well. You finish your ward round, now you need to document every single patient. On average, every center has a minimum of 50 patients in a farm or a ward round. I finish documenting, and then we start taking samples, lab samples. Take your full hemogram, take your kidney function test to the lab, make sure they're back on time before the following day's ward round. I make sure the imaging is followed up. I make sure that I also update the nurses on what medications the patients need to take, and also discuss with them on the management of care. By the time I'm going home, it's 4 p.m. That is in a good center. If I'm in a center where we're only two interns in a rotation, it means that I'm going to sleep only for that night. The following day, I'm back on call, because now my colleague is going to cover me for the next 36 hours. So most interns work between 36 and 72 hours with inadequate sleep. It's not surprising that the doctor in KNH died from hypoglycemia. because of these long working hours. And then you see when you as you working here at Citizen, sometimes you work late nights. And when you work, most of the time you forget to take that suite, or you don't even afford to go, order takeout or go buy ugali and nyama, and you're like, hey, the work is a lot, I can't finish on time, let me finish this first, then go eat. That is the typical day of an intern, and I'm just touching on the iceberg of the whole workload that we have.
Nyakio, are you prepared for such a workload when you're in medical school? Is it something you anticipate going in?
Definitely, throughout. Well, prepared in the sense that this is what we're told will be our eventual fate. Prepared as people, it's kind of one of those things that because it's what you have to go through, you just know you have to shape up for those conditions as she's described.
Dr. Ado, is this how it has been, or when you talk to fellow doctors, has the situation worsened?
Actually, I guess the situation has worsened because, first, the reason we are undergoing all these long working hours is because we are filling in gaps, human resource gaps, whereby this government or the government has not employed the medical officers or the doctors for a very long time. So now that they have actually went ahead to reduce whatever we were earning, so they have input cheap labor as per them to cover up. And the World Health Organization, the ratio between a doctor and the patient is supposed to be 1 to 1,000. But in Kenya, it's 1 to 17,000, far from the rich. Simply because I don't know why the Ministry of Health, which supervises all this, is not putting that into order. We don't know if at all the ministry is incapacitated or they are not on the ground, or it's just because of the lack of how they are going to do this. But there's a serious crisis and problem in the health sector of this country.
We are joined now by Dr. Satya, Dr. Arnold Satya, Medical Officer Intern, Thika Level 5. Good morning.
Good morning, Olive.
So we're discussing the plight of medical interns. Perhaps, Dr. Satya, for those who are not too familiar with what the training looks like for doctors, maybe you can tell us who an intern is.
Yes, thank you so much, Olive, for having us here and having this important conversation, which is important for all of us because the role that medical interns play is critical to our healthcare system. Internship is a mandatory process where we undergo what we call experiential learning. It's experiential learning where you're working, but sort of, being exposed to that work environment. You're already used to it, you're already a doctor. So you are working while learning at the same time from your supervisors. And so when you go to most of these hospitals, the first people who contact patients are interns. Most people who do most of the basic procedures and basic processes to patients, and even advanced ones are medical interns. Internship is a rigorous process which entails long working hours. And, sometimes, because you have to do all this work. And as my colleagues have mentioned, you have to cover in the gaps that are existing in the county, at the county levels, most of the county hospitals and other levels of hospitals. And so you have to make sure that you're there most of the time, doing all this work. For example, are you the one contacting patients when they're admitted? Doing admissions, that's your role. Make sure all the patients are clerked, make sure all the necessary procedures, all the investigations, everything, all forms of management to the patient and how the patient will be discharged. If surgeries are necessary, for example, in the obs and gyn, cesarean deliveries, basic surgeries, appendectomies and all that. That's your role as an intern. You're supposed to do that. And so for you to do that, for you to be able to have enough experience, you have to spend many hours. And that's why people have to spend 24 hours. I'm sure you've heard of 30 hours, 36-hour shifts. It's a normal thing in internship. And so it's only fair that the person who is in charge of you or in charge of your compensation is keen on that, is considerate of that factor. Thank you.
When you speak of compensation,
Yes.
and Dr. Ado had spoken of cheap labor, but before we get into that, how long, Dr. Nambiro, do you serve? I mean, do you work as a medical intern, and do you do a rotation in different specializations? Perhaps you can tell us a little bit about that.
So the internship period is for a whole year, and each rotation lasts 11 weeks, ideally. So you do the surgery, internal medicine, obstetric and gynecology, and pediatric rotations. The ones that are a bit different is the surgical rotation and obstetric and gynecology, where you're required to do surgeries, perform them in the minimum assist, if it's a very complicated surgery. And in most counties, because of the deficiency of human resource, you get that even some interns do those advanced cases in the counties. And that's why Dr. Abdi mentioned that we are the ones who are filling that gap. Interns, doctor interns consist 30% of the healthcare doctors' workforce. So if we consist 30%, then why are they giving us peanuts to fill in these gaps? So after you do your 11 weeks, you in surgery and obstetric, you do your surgeries. On average, every intern works for almost 36 hours. And it depends with your center. Some are as few as 5. For example, our colleague, Dr. Mora, she was in a center where there were only one of them was in one rotation alone. And then Mora, there were 2 in surgical rotation. Surgical rotation is one of the busiest rotations because one, you're required to be in the ward, to be in the clinic, and to be in the surgical theater. If you're in the clinic and there's an emergency, you'll go in. If you're in the ward, there's an emergency, you go in. So there's no time you'll even have a break to take tea. You're constantly running around as an intern. Most of the time, if you get into a hospital, you'll get that intern. It's the intern who'll update your family and update you about your condition. Our seniors are also not well paid, so they'll come between 10 to 1 p.m. And if there's a complicated case, you'll call them. If it's really necessary they get there, then they'll come. Because even if you're an intern and it's a learning center, it's a learning experience, and every time you're calling your supervisor, you look incompetent. I mean, you went to school for 6 years, 3 years basic sciences. I know our Honorable Waiguru said that we are doing practicals in internship. I did my practicals from 4th year to 6th year. 4th year I was in my quote-unquote practicals. 5th year I also did my practicals. 6th year I did my practicals. Olive, 3 years of practicals. In my internship I should be an expert, right? So I am not practicing, I am working as a trained, experienced doctor over 6 years. If you're in Moi University where you're constantly having strikes, trained for 8 years.
All right, Dr. Ado, Dr. Nambiro speaks of peanuts. Can you give us an idea of how much an intern earns on average?
Okay, Olive, let me first explain something before we come to the peanuts. You know, this lot of interns, these are the people whom after finishing their 6-7 years of study, they had to wait for 1 to 2 years for their posting. Something that has never happened. Immediately, we started our normal mandamanos so that we demand for our right to be posted on time. Then another card was pulled. This card was pulled by the former CS. Once there's a liaison committee that's in charge of all the interns. So we met the CS, then she assured us that directly on our faces, you guys will be posted, be patient, we are doing something. We never knew the something that was being done was an undercard against us. Then we met on 13th. The CS wrote a memo or she requested to be advised on how we are going to be paid, but she never advised directly. She actually told them, this is what we want as a ministry, to pay these people for the doctors from 47 to 70,000. And the other cadres also. So sort of advice as she directs indirectly to the SRC. And the next day, the SRC replied by saying, I don't know if it was approved or something, that now these are the rates. Let me tell you, Olive, there's a CBA 2017 that was signed by different stakeholders, not one person. And here comes, I'll term it illegal SRC circular that's unilateral, that serves only the ministry and not the doctors. And that's where now these peanuts come in. These are people who work for long hours without call allowances. These are people who risk their lives to deal with the risky health conditions of our patients without health or rather risk allowances. And then here you come and just pay them a figure without a pay slip, just because we demanded that how many colleagues are we going to bury so that you guys act. So it seems unless these people are pushed, they don't want to do the right thing. And that's why now a whole CS came in front of the media on a Saturday morning to the PR gimmicks, telling the press and the Republic that we have paid these people in full. Mark you, maybe that was the time they were trying to deposit. Up to today, most of the colleagues have not received those peanuts. Actually, yesterday is the time these people now started receiving peanuts. In one center, you can be 10 and all of you have different figures per month. Somebody is 37, 41, 45, 47.
How does that work? Why is it not standardized?
We don't know. Now, those are the questions we also want to ask them. Again, where are our pay slips so that we know you have this allowance, or if at all it's as stipend as they put it, then we be assured that you guys are slaves. We want you to continue slaving in the name of you guys giving cheap labor because we are unable to employ doctors, or we are incapacitated as a ministry. We don't know our roles. And that's now where we come in and request, Mr. President, that we have observed, we have noticed, and we have realized, we as doctors, who are learned human beings, that the people at the Ministry of Health, they are incapacitated, they don't have the know-how or the ability to run that ministry, and we request to reshuffle all of them or to sack them and all of them to go home because they are not doing their work as they're supposed to do. How comes you can overwatch when people are dying and you can't even issue press conferences? You know, our minister, we love her, but when you go to our Twitter pages, we can see condolences to people in Tanzania, somebody passed, but our colleagues who died in their watch or under their watch, there's no even a message of condolences to them and to their families. Shame on that ministry.
Shame.
Yes.
Nyakio, when you hear these stories, because this is your future as medical students, what do you feel, what do you think?
First of all, I'd really like to reiterate to the public, these are interns and I'm a medical student. What does that mean? That right now, for instance, I am a student at the University of Nairobi, a 6th year. So we really don't want that term to be disambiguated to our senior colleagues, whether it's the ones who are interns or postgraduates or anybody who is pursuing studies beyond the undergraduate degree, which I am currently doing, the Bachelor of Medicine and Bachelor of Surgery. So now with that out of the way and seeing the grim future that we have, perhaps I'll even just call back to even like my first week reporting in September, and where now we're being oriented by our consultants. Because earlier you mentioned, are we prepared for this future? Generally, the future we're prepared for is you're going to work 36-hour shifts. You're going to be sent to a rural center where there will be gaps that you will have to fill. Like in that place, as much as you are the generalist, for instance, if there's no pediatrician, you'll be the pediatrician. If there's no surgeon, specialist surgeon, you're the one who will need to cover in for that. If there's no obstetrician, you're the one who will need to be able to be competent enough for the people that you've been deployed to. So that's what you're prepared for. But the future that we're not prepared for is, for instance, due to the delay that our seniors have faced, which was over a year, now people are looking at a grim future of being on the dole for that amount of time. Already we've been in a course which takes 6 years. For instance, we faced interruptions from COVID, so actually some of us have even been here for 7 years. They mentioned the situation which is also happening at Moi, where students are even in school up to 9 years. And now, you see, when you even look at an economy and you look at youth, for us, we're the dividends of the future. So we feel that we're being underutilized, we feel like we're being undervalued. And whether it's even the Ministry of Health, which is also a major contributor to this issue, is also the matter of Ministry of Education, where we just generally feel that there's a critical underfunding of these major sectors which support our economy at large. Because whether it's just our own medical education or even the education of the population at large, when all of this conflicts, you just have issues, whether it's poor health outcomes or even just the quality of life of Kenyans. To be honest, when we even come here today, yes, we're definitely here for the interns, we're here for the future of the health sector, but we're also here for Kenyans. Because we're simply here to say, if as our future is threatened, and we're even being told, this profession of yours, it's not even so much about it not being lucrative, you're just not even going to be able to practice, you're not going to be able to serve in the way that some of you have even been envisioning since you were in primary school. Because personally, even somebody like many of us, if not most, we want to serve Kenyans, we want to stay in the country. But in that very first week when I come to school, my consultant is telling me, there's nothing for you here. And they'll say that because if I go to a center and it's not well facilitated, even in terms of the amenities which are there, you're not going to be able to be paid. If now, like my senior, Dr. Desiree, Dr. Pharmacist Francis Njuki, if my grim future is to not even be able to be alive or to be able to save lives, then he's very right. What is there then for us in the profession? You're not even able to just do to your passion. So that's what we really come to underpin to Kenyans, that we should really be worried about this.
Dr. Satya, is there a sense of disillusionment with the profession?
Thank you so much, Olive, for that question, because I'm sure you believe that doctors are gentle people. And by the time they get to a point where they have to go to the streets, they have to issue strike notices, we have to spend time occupying MOH instead of being in a hospital treating Kenyans, then know that, we've gotten to the end. I'd just like to paint a brief picture of how we've gotten to this point for the sake of our viewers. It all started when, our former CAs started this fracas, saying we have to find a way of paying interns. It's no longer sustainable. And so, first of all, our posting was delayed. It started the delay in posting. And when that started, issues with the payment and all that, a strike was issued in March alongside other issues to try and deal with them. After 56 days, a return to work formula was signed, and doctors decided to go back to work, awaiting resolution of the given issues. During the 60-day period, the issue of internship was supposed to be solved and a solution be found. Meanwhile, there was a court process that was ongoing. After the 60 days, nothing had happened in the ministry. The ministry had not done anything significant to look like it was trying to find a solution. So after the 60 days as interns, we decided to sign a contract, an agreement, that we are going to start our internship, of which we started on 1st August this year, awaiting a resolution of the court process, because that's what MOH was using as an excuse, not to determine or to tell us the determination of our terms of payment, which is a necessary component according to the labor laws. For you to be posted, for you to be employed, you have to understand how much you're going to be paid or compensated. So while we're waiting for the court process to end, the court process, so the verdict was given on 17th of October, after we had worked for about 3 months. And the court determined that yes, there's an existing CBA, it's a legal document, it's recognized by all legal entities, and so any party making a determination on a payment of anyone involved in the CBA has to be cognizant of that factor. So while at that, it's also legal for any government entity to seek advice from the SRC as a constitutional body, which is independent. So the resolution was, we'll not have a final determination yet. Go and negotiate with the union, KMPDU and the ministry. Let the two negotiate and come up with a final determination. So after that, that was given 90 days. We are still within the 90-day period. Just within the 90-day period, all of a sudden we are wondering, remember we are still working 4 months, no payment, no nothing to eat, no way, you don't know how you'll get to hospital.
You haven't been paid in 4 months?
No, yeah, we had not been paid for the 4 months.
Wait, so you started in August?
In August.
So the August,
Yes.
September,
Yes.
Okay, October,
Yes.
November. Okay.
Exactly. So, but then we're waiting for a determination of the, of the pay. So if maybe the ministry had the intention of having, maybe interns having something, and meanwhile as we wait for the determination, it will have been clear if we are giving you, is it an advance? Are we paying you for the 1 month as per CBA? Are we paying you as per this? The ministry goes ahead arrogantly amidst the negotiations to give us, values just thrown from anywhere. So right now we are just in limbo. We don't know, have we been paid for, because the value that is there is as per the 1 month, before tax. So is it the value for the 1 month or is it for the 4 months? And if it's for the 4 months, then it's unfortunate. So you see, as doctors, it's our intention to serve, Kenyans, to serve people. But you see, if you have to get to the end where, such people don't consider you, then I think it's only fair for us to get out, because a demotivated workforce, a demotivated doctor is a dangerous person to serve you. A person who is so tired, someone who can fall in front of you because of hypoglycemia and all that, and the things they're suffering. I'm sure you don't want to be served by a doctor who is demotivated, who is, tired, and all these other factors. Yeah, so why MOH? Our question is, what was the determination? The negotiations are still on as per the court process. What was your basis of this? Yeah, have you already made a foregone conclusion that this is what you're going to pay us, and that you're just arrogant, you're not going to listen to anyone? But Olive, it only points to one thing. The ministry is afraid of negotiations. Someone who is in the wrong is always afraid, as someone says. They know they have nothing to, to explain this reasoning. I've had the privilege to attend all these negotiation meetings. So far, they've been 4 with my colleague Abdi. And some of the reasons that they give, it only shows a lack of goodwill. You see, for example, the first reason they say, we sought advice from SRC. All these things have legal processes. The union was basically asking for basic documents. It was saying, yes, you sought advice. Where was the meeting? Where are the minutes to show us you had a meeting, you discussed, and these are the reasons as to why you sought advice from SRC? As simple as that. We've been asking for these documents, or the union has been asking for the documents from the first meeting. No document has been served so far. You see, it only points towards dishonesty. And then when you go to SRC, yes, it's an independent body. But as a constitutional body, anything in this country, even the presidency, no one has unchecked power. We have to determine, how are you able to determine this salary? How did you determine and say interns deserve 70,000? Where is your job evaluation? Show us. Because as the SRC chair once said in this studio, anyone is paid according to their output, according to their impact and level of training. Show us, where was your determination on the output, on the impact to society, on the level of training that we underwent for 7 years? Hey, as simple as that. Nothing has come so far. Another thing, you talk of... So,
do you mind me just putting a pin in that? Yes. I'll mark down that you're coming back. Yeah. But we need to take a break, but we'll come back and I'll allow you to conclude the point you're making, what your demands are, and what future there is for this profession. We're sitting down with medical interns and their plight, given a strike notice for December the 22nd. As well as a worrying trend that points perhaps to the worsening mental effect on overworked interns, as they've told us. So stay tuned for more on that.